Hello and welcome to the Practical Pediatric Medical Information Channel. Wow, that's a mouthful. I am MZMD. I'm a board-certified pediatrician. I am licensed in several states in the United States. I would like to emphasize that this video and all other videos on this channel are meant to be informational only and are not meant to be a substitute for diagnosis and treatment by your child's doctor. I hope that you will join me on these coming videos, and do not forget to like, share, and subscribe. Remember, subscribing does not mean that you're paying anything, but that's a way of notifying you when a new video has been uploaded to this channel. So let's proceed to the next topic. Pink eye is a descriptive term and just means that the eye is red or pink. It does not tell you what the cause of that redness or pinkness is. In fact, there can be many reasons why your eyes may be red or pink. The medical term is conjunctivitis. Conjunctivitis means inflammation of the conjunctival layer of the eye, which is the layer which goes over the whites of the eyes and under the eyelids. When that layer of tissue becomes inflamed, it becomes red or pink. The term itis means inflammation. So if you have arthritis, that means inflammation of your joints. Bronchitis means inflammation of your bronchi or bronchial tubes. And then there is dermatitis, which means inflammation of the skin. So, conjunctivitis can be from many different reasons. You may have allergic conjunctivitis from pollen or being allergic to your cat or dog, and the treatment for that would be an oral antihistamine or a topical antihistamine in the eye. You may have chemical conjunctivitis when you jump into a pool where it's heavily chlorinated. The eyes may become red or pink. For some significant forms of chemical conjunctivitis, we would use a topical steroid as the treatment. You can have trauma to the eyes, which would give you redness or pinkness. So for example, you may have a scratch on the cornea or the clear part of the eye, which would result in redness or pinkness of the eye. And you may also have contact lenses causing a corneal abrasion. You can have intrinsic problems in the eyes, which may lead to redness or pinkness of the eye. This is most common in adults, not so much in children. And then there are infectious forms of conjunctivitis. Infectious conjunctivitis are mainly two types: viral and bacterial. You've heard this story before. Viral conjunctivitis is not treatable with antibiotic eye drops, while bacterial conjunctivitis is treatable. How do we tell the difference between viral and bacterial conjunctivitis? Viral and bacterial conjunctivitis both may give you red eyes, both may give you some irritation, burning, tearing, both may give you some crustiness when you wake up in the morning. However, bacterial conjunctivitis will give you eye discharge throughout the day. So if all you have is a little bit of crustiness when you awaken in the morning, it is most likely viral. If you have eye discharge throughout the day, it becomes more likely to be bacterial and therefore would be treatable with an antibiotic eye drop. In babies less than 3 months of age, there is another cause of infectious conjunctivitis, and that is infections which have been passed by the mother during the birthing process. And this is if the mother has a form of sexually transmitted infections. Typically, it would be something like chlamydia or gonorrhea, which during the baby's passage through the vaginal canal, they would become infected, and then the eyes may become red, inflamed, and have discharge. There's also another reason for babies, young babies, eyes becoming red or inflamed, and that is a tear duct obstruction. Less than 6 months of age, some babies may have an obstruction to the tear duct, so the tears do not drain properly. They well up into the eye. Then as time progresses, they may get mucousy, and then that mucus may become yellow or green, which will then lead to inflammation in the white part of the eye. While we're speaking about eyes, let me say something about the eyelids. Eyelids can become swollen and they can become red from different reasons. You can have a swollen eyelid from an insect bite, and part of that may be red. And you can also have a swollen eyelid from an allergic reaction, and you may have swollen eyelids from problems with your kidneys functioning properly. We worry about infections in the eyelids when the area of the eyelids, whether it be the top or the bottom, and sometimes both, become swollen, red, and accompanied by fever or pain. So we do not take red, swollen eyelids accompanied by fever or pain lightly. These infectious conditions are usually referred to as periorbital cellulitis or orbital cellulitis. And both of these are very serious conditions which need to be treated promptly. Most of the times, these require IV antibiotics or sometimes surgical drainage. These are examples of orbital and periorbital cellulitis. So, in conclusion, a red or pink eye does not mean that you need antibiotic eye drops. It may, but your doctor needs to weigh all of the information, history and physical, and then make a determination what exactly is leading to the red or pink eye. And as you've heard, there are many reasons. So depending on the reason, the appropriate diagnosis and appropriate treatment will then be administered. Hope this video has been useful. I encourage you to join me on my next video. That's all for now, and this is MZMD wishing you a healthy life.